Welcome to the deep dive. Today we're really getting into something close to many of our hearts, caring for your aging cat.
Absolutely. If you've got a feline friend, you know that bond, it's special.
Yeah.
And it just gets deeper as they get older.
Exactly. We all want to give them the absolute best senior years possible.
So we've dug through a whole pile of sources,
Mhm.
articles, research, vet insights, you name it. Our goal here is to kind of cut through all the information overload,
Yeah, pull out the really key stuff, the actionable knowledge, give you a shortcut,
a
basically.
shortcut to being well-informed so you can navigate the challenges, but also the joys of having an older cat.
And we found some really interesting things, like how our whole understanding of what old even means for a cat has changed.
hmm And we'll explore some common health issues, things that might sound, well, surprisingly familiar because they often mirror what happens in human aging.
And most importantly, we want to give you practical tips, stuff you can actually use at home starting right away.
Okay, so let's dive in. What do these sources actually mean when they talk about an old cat? Is there like a magic number?
That's the first thing they clear up. And no, thankfully, it's not some strict cutoff age. It's much more like it is with us humans. It really varies.
Right.
Dr. Schulman and Dr. Abood, they suggest cats often hit what you might call middle age around 7 to 11 years.
Okay.
And then they're generally considered geriatric after that. But, genetics, their environment, lifestyle, it all plays a huge role, just like us.
And the really good news, those sources point out, is that cats are living much, much longer these days.
Yeah, significantly
A
longer.
lot of that is down to just better owner care and, importantly, more cats living safely indoors. Stephen Marks highlights that point.
And this is such a crucial perspective, I think. Dr. McCullough makes it really clear. Getting older, age itself, isn't a disease.
That's a great point.
Yeah, many of these conditions that pop up as cats age, they aren't just inevitable. They can often be managed, sometimes really effectively. You can even slow down how they progress.
That offers a lot of hope, doesn't it? It's not just decline.
Not at all.
And what's interesting, too, the sources also talk about the upsides, the benefits of having a senior cat.
Oh, yeah. Like what?
Well, they're often calmer, you know,
Hmm.
more patient. Dr. Seith mentions they can be fantastic companions, especially for families.
Right. Teaching kids about responsibility, empathy.
Exactly.
Mm.
And they can become this really stable, comforting presence. Real emotional support, especially during tough times.
They really do weave themselves into the family fabric. Okay, so let's put specific diseases aside for just a second. What are some of the general physical changes the sources say we should expect as they head into those golden years?
Well, we see changes that honestly mirror human aging pretty closely. Senses can start to dim a bit.
Sight, hearing.
Sight, hearing, taste, smell.
Mm.
They might not be quite as sharp. But here's something fascinating Dr. Hart and Dr. Myers point out. This sensory loss often bothers us, the owners, more than it bothers the cat.
Really? How so?
Cats are incredibly adaptable. They just rely more on memory, their mental map of the house, and their other senses.
Ah, like that story about Rudy, the Abyssinian who is mostly blind.
Exactly. Navigating her home at top speed just using her internal map. It's amazing.
It really is.
Now, one thing though, a weaker sense of smell can affect their appetite sometimes. Food just isn't as appealing.
Okay, so what can you do about that?
A really simple trick mentioned is just warming up their wet food slightly, like just a few seconds in the microwave. It really boosts the aroma.
Ah, makes sense. Simple, but could make a big difference.
Definitely.
What about their bodies? Mobility, digestion.
Yeah, bones and muscles change naturally. Often means less jumping, less
Right.
running around, maybe less desire for really intense exercise.
And digestion.
That can slow down too. Their metabolism shifts. It's interesting, they might actually gain weight up until about age 10. But then, later on, you might see weight loss. Their bodies just become less efficient at digesting protein and fat. Dr. Wachslag suggests these older seniors might actually need more protein in their diet, not less.
That's counterintuitive. And water intake. You mentioned that's important.
Huge. Dr. Wolf notes their thirst response can decrease, so they might not drink enough on their own, making them prone to dehydration.
Which affects everything, especially kidneys.
Spot on. And Dr. Fortney adds that gut movement, motility, can slow down, and they might produce fewer digestive enzymes too.
Okay. And dental health. You mentioned that earlier.
Oh, dental health is a big one.
Yeah.
Aging teeth and gums. It's almost a given, unfortunately.
Yeah.
Periodontal disease is incredibly common.
And serious, you said.
Very serious. Dr. Gangler uses this powerful image. He calls it like having an open wound in the mouth.
Wow.
Because of the bacteria from those infected gums, they can get into the bloodstream and travel, causing damage to kidneys, liver, even the heart.
That really drives home how crucial dental care is, doesn't it?
Absolutely. Beyond that, the sources mention potential changes in other organs too: pancreas, liver, heart, lungs, and the immune system naturally declines a bit.
Which can be influenced by diet, right?
Yeah,
Antioxidants.
exactly. Dr. Hawley and Dr. Carey talk about cell damage from oxidation, sort of like rust, speeding up aging, antioxidants like vitamin E. Several experts mentioned it might help support the immune system and maybe slow some of those processes down.
And the nervous system. Brain changes.
Can happen too. Reduced blood flow to the brain, some loss of neurons, and their skin and fur often thin out, making them more sensitive to heat and cold.
And grooming, if they stop grooming themselves as much.
That's often a key sign. A decline in grooming is frequently one of the first subtle indicators an owner might notice that their cat just isn't feeling well.
Okay, so those are the sort of general age-related shifts. Now, let's dive into some of the more common health concerns that often come up. This is where, it can feel a bit overwhelming. The list seems long.
It can seem that way, yeah. But the key thing the sources emphasize is knowing what to look for and knowing that options often exist. Older cats are just more susceptible to chronic, long-term stuff.
Like arthritis, kidney disease.
Arthritis, kidney disease, cancer, diabetes, hyperthyroidism, heart disease, dental disease definitely, sensory loss, even cognitive changes. Many of them, like we said, mere human conditions.
And the good news is veterinary medicine has come a really long way in managing these.
A very long way.
So let's start with mobility, arthritis. What should an owner be looking out for?
Arthritis is super common in seniors, but the signs can be really subtle. It might just be they're less willing to jump up onto the couch, or maybe they hide more.
Not necessarily limping or crying out.
Often not. They might just seem stiff or less active overall. Cats are masters at hiding pain. That's something the sources really hammer home.
So you have to be observant.
Extremely. Management isn't usually about a cure. It's about comfort and maintaining mobility. Weight control is huge if they're overweight, less stress on the joints.
Simple things at home help too.
Big time. Adding little steps or ramps up to their favorite spots, getting an orthopedic bed, or even a heated one, those can make a real difference.
And medically.
Vets might use pain relievers or anti-inflammatories, but in the sources, vets have to be super careful with these in cats. Potential side effects are a concern.
Right. What else?
Nutraceuticals, things like glucosamine and chondroitin supplements, are often recommended. They support joint health. Some senior diets even include them.
I remember a Pumpkin story from the sources. Just switching her food to a senior diet with joint support and adding some little steps.
Made a big difference for her arthritis, yeah. It shows how those seemingly small adjustments can have a real impact. They absolutely can.
Okay, moving on. A really prevalent issue you mentioned, kidney disease, chronic renal failure.
Yep, extremely common. The sources say maybe 30% of senior cats have some degree of it.
Wow. What are the signs owners are most likely to spot?
This is so key for catching it early. The kidneys fail gradually, right? And cats are champs at compensating, hiding it.
Until they can't anymore.
Exactly. Eventually, you'll likely see increased thirst, the water bowl emptying faster, and increased urination.
So larger clumps in the litter box, or maybe accidents outside the box?
Precisely. Those are classic signs. Also, maybe weight loss, eating less, being lethargic, maybe their coat looks dull, sometimes vomiting or bad breath.
So what's the sort of shortcut insight here? What's the main takeaway for managing kidney disease?
The big takeaway is that while it is progressive, you can often manage it, sometimes for a long time. The focus is on slowing it down and managing symptoms.
How?
Therapeutic diets are usually step one. These are special prescription foods, low in phosphorus and protein, designed to be easier on the kidneys.
Palatability can be an issue sometimes, though, right? Getting them to eat it?
It can be. Sometimes you have to find a balance, maybe feed a suboptimal diet they'll actually eat rather than the perfect one they refuse. But what's often a real game changer, mentioned by Dr. Little and Dr. McAnulty, is owners learning to give subcutaneous fluids at home.
Sub-Q fluids. Okay, that sounds a bit intimidating, but the sources made it sound doable.
It really is. It just means injecting sterile fluid right under the skin, not into a vein. It's pretty straightforward once you learn how.
And why is that so helpful?
It keeps the cat hydrated, which is crucial. It helps flush out the toxins that the struggling kidneys can't handle efficiently. It makes a huge difference in how they feel.
Like Cricket's story, the cat who got stressed at the vet.
Exactly. Vet visits were tough on her. But getting fluids calmly at home transformed her quality of life. It really empowers you, the owner, to be part of the care team.
That shift from everything happening at the vet to some care being owner administered at home seems really significant for chronic conditions.
It's huge for quality of life for both the cat and the owner.
Okay, what about hyperthyroidism? Another one that sounds pretty common in older cats.
Very common. Basically, the thyroid gland goes into overdrive and produces too much thyroid hormone. Speeds everything up.
So what does that look like?
You might see weight loss even though they're eating like crazy, sometimes ravenous, increased thirst and urination again, maybe hyperactivity, vomiting. Sometimes their coat looks greasy or unkempt.
So some overlap with kidney signs, but the appetite thing is often opposite.
Exactly.
Yeah.
Diagnosis is usually straightforward, a blood test to check their T4 hormone levels. And the sources outline 3 main ways to treat it.
Which are?
One is daily medication, like a pill called Topazole. It controls the hormones, but it's lifelong, needs monitoring. Second is surgery to remove the overactive thyroid tissue.
Okay. And the third?
Radioactive iodine therapy, I-131. This one is often highlighted because it can actually be curative with just a single treatment for most cats.
Ah, like Blanche's story in the material. That worked well for her.
Yeah, it's often very effective. The cost upfront is higher than, say, a month of pills, but the sources point out it can be more economical in the long run since it often solves the problem permanently.
Right, a one-time investment for many cats. Okay, let's circle back to dental disease. We touched on how serious it is. What's the key message there for owners?
The main takeaway, home care like brushing is fantastic for prevention. But once disease is there, professional dental cleanings under anesthesia by your vet are absolutely essential.
Essential for treating the existing disease and the pain, right?
Exactly. Dr. Holmstrom really emphasizes that vets take extra precautions with seniors under anesthesia, pre-anesthetic blood work, maybe heart checks. It's done carefully.
And extracting teeth. That sounds really drastic.
It does sound scary, I know. But the sources, like Dr. Gangler and Dr. Holmstrom, they stress that cats tolerate extractions surprisingly well. And removing those painful infected teeth, it dramatically improves their comfort and their ability to eat.
So it's often really beneficial, even though it sounds extreme.
It often significantly boosts their quality of life by removing that chronic source of pain and infection. Keeping key teeth like canines is ideal if possible, but health comes first.
Okay, shifting gears again. Changes affecting the brain. Cognitive dysfunction, sometimes called feline senility.
Yeah, this is something vets and owners are recognizing more now,
Mhm.
especially in cats over, say, 13, and it becomes pretty common in cats over 16.
So what is it exactly?
It's basically age-related changes in the brain, kind of like Alzheimer's in people, but in cats. These changes cause shifts in behavior that aren't explained by another physical illness.
What kind of behavior changes are we talking about?
They can vary quite a bit. Dr. Dodman lists things like disorientation. The cat seems lost in familiar places, maybe gets stuck in corners, or just stares blankly.
Oh, that sounds distressing.
It can be. Also, increased vocalization, especially that nighttime yowling some older cats do. Changes in how they interact, maybe less interested in petting, or suddenly more clingy or irritable. Altered sleep patterns, and sometimes litter box accidents even when there's no UTI or kidney issue.
That must be heartbreaking for owners to witness. How is it managed?
Well, first, the vet absolutely has to rule out other medical causes for those signs. Things like pain from arthritis, hyperthyroidism, kidney problems, high blood pressure, they can all cause behavior changes.
Right. Rule out the physical stuff first.
Exactly. Once it seems like cognitive dysfunction, management often involves environmental enrichment, keeping their minds active, sticking to predictable routines. There's a medication, Anapril, used off-label sometimes, and some senior diets now have ingredients aimed at supporting brain health.
Max's story in the sources really painted a picture of how those signs progress and the emotional impact on his owner. It highlights that this is a real medical condition, not just the cat being difficult or old.
It really is. And understanding that can help owners cope and provide the right support. Beyond these major ones, the sources touch on other potential issues too. Cancer, diabetes, especially in overweight cats.
Heart disease, liver issues.
Right, even strokes, though cats often recover surprisingly well compared to humans. The common thread is just that older cats are more vulnerable. Early detection is everything.
Which brings us back to owner observation and regular vet checks being critical.
Absolutely critical.
Okay, so that's a run-through of common medical issues. It's a lot. Shifting gears now. What about the big picture? What comprehensive strategies do the sources emphasize for overall senior cat care, It really sounds like a partnership.
It absolutely is. A partnership between you, the owner, and your vet. The sources strongly advocate for a holistic approach, or maybe complementary is a better word, combining good conventional veterinary medicine with really attentive home care and sometimes alternative therapies if appropriate. It's about the whole cat.
And nutrition keeps coming up again and again.
Because it's foundational. Age-specific diets are often recommended because nutritional needs change. Managing weight is huge. Keeping them lean throughout life helps prevent so many age-related issues like diabetes and arthritis.
And then those special therapeutic diets if they do develop a condition.
Exactly. Kidney diets, dental diets, diabetic diets, weight loss diets, they're often a primary tool for management. There's even mention of nutrigenomics, this cutting-edge field, looking at how specific nutrients can actually influence gene expression related to health and aging. Really fascinating stuff.
We heard that simple tip too, warming food for picky eaters whose sense of smell might be fading.
Yeah, simple but effective. And things like puzzle feeders. They're not just for kittens. They can help keep senior minds engaged and encourage a bit of activity.
What about actual exercise? They might not be climbing the curtains anymore.
Probably not. But gentle exercise is still important. Short play sessions with a feather wand, maybe rolling a ball, even hiding small treats around the house to encourage searching. Adapting to their ability is key.
And for cats with arthritis or weakness.
Those steps or ramps we talked about are fantastic for helping them reach favorite spots without painful jumping. Makes a huge difference to their independence and comfort.
Now, the sources really stress the owner's role. Observation, home care. What's the absolute core message there?
It really boils down to listening with your heart, as one source beautifully put it, that gut feeling you get that something's just on off.
Yeah.
Noticing a subtle change in your cat's routine, their personality, their energy level.
That's often the first sign.
Often the very first and most important sign that something's wrong, sometimes even before you see obvious physical symptoms. It helps to kind of create a mental or even written health report card for your cat.
What do you mean by that?
Just knowing their baseline. What's their normal appetite? How much
Yeah.
do they usually drink? What do their stools normally look like? How often do they use the litter box? What's their typical energy level? Knowing that baseline helps you spot deviations immediately.
So it's all about knowing what's normal for your individual cat.
Precisely. Monitoring that water intake, how much they're peeing, the color, any accidents, huge clues for kidney disease or diabetes. Same with defecation frequency, consistency, straining, signs of constipation or other issues.
And checking their coat, skin, claws regularly.
Yep. Like we said, a declining grooming is a big red flag for illness or pain. And running your hands over them regularly to feel for any new lumps or bumps is vital. In an older cat, any new lump needs checking by the vet pronto.
Which is why those regular vet visits are so non-negotiable, right? Not just waiting until there's a problem.
Absolutely non-negotiable. The recommendation is strongly for twice-a-year checkups for cats over 10. Dr. Webster calls it proactive care versus reactive fire engine medicine.
Catch things early.
Exactly. It lets the vet spot subtle changes, track weight, listen to the heart, check teeth, and getting baseline blood work and urine tests done around age 7 to 10 gives invaluable comparison points for the future.
Okay, let's talk practicality. Giving meds can be tough.
Oh yeah, the sources definitely acknowledge the challenge. Pilling a cat is not always easy, but it's often necessary. The key tip is talk to your vet about options.
Options like?
Don't just assume it has to be a pill. Ask if the medication comes in a liquid form. Can it be flavored by a compounding pharmacy? Is a transdermal gel an option? That's where you just rub it on the inside of the ear flap. Works for some meds, like the hyperthyroid one.
That sounds way less stressful.
It often is. Reducing that medication stress improves quality of life for everyone. Also, learning safe, gentle restraint techniques, like the scruffing method described, can make pilling safer and quicker if you do have to do it.
And home injections, like the sub-Q fluids or insulin?
The sources really emphasize that owners can learn to do these things. Your vet team can teach you. It seems daunting at first, but it becomes routine, and it's often much less stressful for the cat than daily vet visits, and more economical too. Hugely empowering.
Environmental tweaks seem like another powerful, practical area.
They really are. Simple things can make a world of difference. Extra litter boxes, maybe closer to where they sleep. Definitely low-sided boxes for easier access if they're stiff.
Those steps and ramps again.
Yep. For beds, windowsills, couches. Heated beds are wonderful for soothing arthritic joints, especially in cooler weather. Having good cleaning products on hand for accidents is practical, takes the stress out of managing issues like incontinence or cognitive dysfunction messes.
Even simple things, like for a cat losing vision.
Keep the furniture layout consistent. Don't move their food and water bowls. Rely on routines. As Rudy's story showed, they adapt incredibly well if their environment is predictable.
Pain management. This theme runs through everything.
Because it's fundamental.
Mm.
And again, cats hide it so well.
Mm.
We have to assume that chronic conditions like arthritis, dental disease, cancer, they involve pain. Managing that pain is absolutely central to their quality of life.
And it's often a multi-pronged approach.
Yes, multimodal is the term vets use. Combining strategies,
Mm.
weight management, home comfort modifications, appropriate pain medications, always used cautiously in cats. Maybe nutraceuticals, sometimes things like acupuncture, laser therapy are mentioned as options too.
Okay, let's address the elephant in the room. Cost. All this care, especially long-term chronic care, can add up.
It definitely can, and the sources acknowledge that reality. Chronic conditions require ongoing investment. They mention vets are often understanding, sometimes offering payment plans. Pet insurance is discussed.
But it gets more expensive for older pets and doesn't cover pre-existing conditions, right?
Generally, yes. Premiums go up with age, and anything diagnosed before you get the policy is usually excluded, so it helps most if you start when they're young. Specialist care surgeons, oncologists can be expensive too.
But owners often want to do everything they can.
The surveys mentioned bear that out. Many people see their pets as family members and are willing to make significant financial sacrifices. But importantly, Dr. Kitchell points out, even if the absolute top-tier, most advanced therapy isn't financially possible, vets can almost always work with you to find more economical options that still provide good comfort and quality of life. It's not always all or nothing.
That's good to hear. Ultimately, all this care, all these decisions, they revolve around quality of life. How do the sources suggest we think about that for our aging cats?
It really comes down to their comfort and their ability to still find enjoyment in their daily lives. It's a very personal assessment, something you judge by comparing their current attitude, activity levels, and behaviors to their normal past.
Are they still interacting? Still seem content.
Yeah, are they still enjoying interactions with you? Do they still purr? Can they eat, drink, and get to their litter box without significant distress or pain? That connection with their owner, that bond, is highlighted as a really key part of their quality of life.
Yeah.
It's a judgment call made with your family and your vet.
And that leads inevitably to the toughest part of loving an aging pet, end-of-life decisions and saying goodbye.
It's the hardest part, but a necessary part of the conversation. The sources approach euthanasia, frankly, but with compassion, describing it as a final act of love, a peaceful release from suffering when quality of life has truly declined and there aren't other good options left.
They offer some guidance on the process.
Yes, Dr. Garrett and Dr. Seif talk about things like being present if you can, asking about sedation options to make it calm, understanding the steps like catheter placement. It's about making it as peaceful and loving a passage as possible.
And the guilt that's mentioned as common.
Very common. Even when you know intellectually it was the kindest thing, that guilt can creep in. The advice is to trust you made the best decision you could with the information you had, out of love for your companion.
And grief is real.
Absolutely.
Yeah.
Deeply real. It might hit right away, or sometimes it's delayed. That feeling of emptiness, missing their presence, the routines you shared, it's all normal. Memorializing them can help.
How so?
Things like getting a paw print impression, keeping a lock of fur, maybe having a small ceremony, making a donation to a shelter in their name. These rituals can provide comfort and aid the grieving process. Comfort zone tips also mention creating memorials.
And talking to kids about it.
Also important. Dr. Kitchell and Dr. Seif point out that kids really learn how to process grief by watching their parents. Being honest, simple, emphasizing the love and the happy memories. That's key. It's okay to show sadness.
And the question of getting another cat.
That's deeply personal. There's no right or wrong time frame. The sources beautifully suggest that sometimes a new cat finds you when the time is right. It's not about replacing the one you lost, but about carrying forward that capacity for love, maybe as a legacy.
Wow. Okay. That really was a deep dive into this material, covering a lot of ground.
It really was, and I think the key takeaways are pretty clear. Aging in cats, it's complex, yes, but it's also manageable with attention, care, and knowledge.
Being proactive seems crucial, knowing those subtle signs, partnering with your vet.
Absolutely essential, and remembering that for many of these age-related conditions, there are effective treatments. conventional medicine, simple home strategies, sometimes complementary therapies working together.
And underlying it all is comfort, pain management, and preserving that quality of life, that bond.
That's paramount, cherishing those golden years.
So this deep dive, it was really about taking all that information from the sources, distilling it down so you feel more equipped, more confident, navigating this journey with your own aging cat, giving them the best care possible, rooted in understanding and love.
And the sources leave us with a really powerful final thought. It says, we are the best memorials that we can create for our pets. If we can make our lives better because of them, that is a wonderful tribute.
That's beautiful, makes you think. What is making your life better because of your cat look like, especially now as you care for them in their senior years? Definitely something worth reflecting on.